We're going to do a quick video on small intestine fungal overgrowth. If you're looking for what to do about a fungal issue, they're pretty much the same across wherever that fungal issue is presenting. People like to talk about SIFO or a fungal overgrowth specifically in the small intestine. It really doesn't matter where you have it, but the symptoms, especially in the gut, consist of mostly chronic issues. These patients come in, they've had these problems for a long time. They have a perfect diet and they still have these issues. Fatigue, fibromyalgia type symptoms, chronic pain is a big thing with a fungal overgrowth, and we'll talk a little bit why. Chemical sensitivities, so if you have a strong sense of smell towards, you walk into Yankee Candle and you have problems with those smells, they give you headaches, things like that. Definitely a sign that you might have a fungal issue. Autoimmune problems definitely are exacerbated and sometimes triggered by fungal overgrowth. Joint pain, headaches, brain fogs are very, very common. Chronic fatigue and brain fog, most commonly, you're going to see a fungal issue in the gut. Other common things that people might come in with: thrush, which is a fungal overgrowth that's in the mouth, but it can happen all the way throughout. Candida, and of course yeast infections. Okay, the traditional or natural approach to addressing a overgrowth issue with fungus is removing things that exacerbate a fungal issue. So that's no sugar, no cheese, no yeast, no fermented foods, especially fermented soy products like Chinese food, alcohol. When we do our corrections, we allow fresh fruit, but some people even have to take that out of the equation. The other thing that we typically do is that not only remove what is causing an overgrowth or exacerbating an overgrowth, but cleaning the walls of the gut with using a broad spectrum antimicrobial herb. Things that work against bad bacteria as well are nice. Malia, Morinda, golden thread. There are probably about 15 to 20 different herbs that we use, but those are really common ones that are work for a lot of different purposes. So I would recommend maybe looking at one of those. Pick the one that you like the best. If you're not going to work with somebody that's going to help you specifically dial that in, I would go with one of those three. The secondary things to address, things that most people completely neglect when they're trying to correct a fungal issue, are toxicities, chemical sensitivities, and then addressing the rest of the immune system. So the reason why people neglect to do this is because of how complicated it can get. But if you have a chronic yeast issue that isn't getting better, then it has to be something outside of what you're doing that is keeping you from healing, keeping you from addressing this overgrowth. So, types of toxicities include, but are not limited to, ammonium detoxification problems. Ammonium detoxification simply is when you have proteins and they get broken down. You'll see it in your blood work as creatinine, your BUN, and your uric acid. So when the proteins get broken down, they cannot get broken down any further than those three elements. If you're having trouble breaking those down and then you get a buildup of it, it's either because you have too much coming in or you don't have enough cofactors helping you break it down. Usually we see people having trouble, or combination of both, not having the cofactors required to break those down because of various other problems. And you can eliminate some of those symptoms just by correcting the ammonium detoxification problem. Very commonly, brain fog and anxiety are linked to ammonium problems. Fatigue, also definitely people getting worn down. And basically that can come from an athlete even who's working out too much and you have too much muscle breakdown and then your body's getting bogged down with all of those particular problems. Or in this case, we're talking about inflammation in the gut generated by a fungal issue that's causing a breakdown of the gut. The gut is made up of protein, if you didn't know, and that protein, once broken down, has to get taken up by the blood and then filtered and then taken care of. So just like anything else. So addressing that is very helpful in getting over a recurrent or a more difficult fungal infection. So Other chemical issues would include aldehydes and hypochlorite, but typically more of an aldehyde issue with a fungal issue. So there are several nutrients required to break that down, but it's not a super long pathway like the ammonium detoxification pathway is pretty big. But molybdenum is very common with that. So in general, if I'm not going to see it, if you're not going to see somebody trained that knows what they're doing with this, molybdenum is a pretty safe bet. You see skin issues with molybdenum deficiencies as well. But in particular, having the sensitivities to smells, that's almost always connected to an aldehyde issue, or at very least it's a chemical sensitivity problem. So sometimes not addressing that will cause the inability to get over the fungal issue. So addressing both the aldehydes and the ammonium issue is very important in tackling a fungal issue, especially if you've done everything else right. The cool thing with the ammonium detoxification thing that we talked about with the blood work is that you can kind of see it. If the protein's normal, you have to narrow the ranges down to functional ranges. But if you can narrow those down, you'll see an imbalance between either not enough creatinine, not enough BUN coming through, or not enough uric acid. You'll see the lazy worker. So molybdenum can help detox ammonium as well. So that's kind of a safe bet, but it's not always there. If you have an anemia issue, then iron definitely needs to be taken care of because that's in that ammonium detoxification pathway. If you have gout issues, this is kind of the exception. You do not want to help accelerate that problem because you already have an excess of uric acid. So it can get complicated fast. Again, this is why people avoid addressing it. But just know that don't get discouraged if you're doing everything right because there are more things that you can address to get ahead. Okay, I'm going to do a quick summary about what we talked about and some things that maybe we didn't. So reducing stress hormone production and inflammation. I've talked about this in my other videos ad nauseam. So I'm going to kind of avoid talking too much about that and boring people that are already here from watching those other videos. But the antimicrobial herb, something like Malia, we're just going to pick that one. Eating 100 grams of protein, it's made out of protein. If you're breaking it down, you need to at least make sure you're eating an adequate amount of protein. 100 seems like a lot, but it's a great goal, and you're going to feel a lot better once you're there, especially if you haven't been reaching that. Magnesium, zinc, B6. The reason I pick those is because if you have a lot of stress hormones, you have a lot of inflammation, you probably don't have a lot of magnesium, zinc, or B6 because you're busy using it all up. If you have any anxiety, depression, mood issues, you probably do need to be taking at least one of those three. And if you're not going to see anybody, you're going to guess. Might as well take all three. The Malia for the gut, to clean the walls. The turmeric to reduce the inflammation. I recommend typically around 3 grams, but you can take as little as 500 milligrams up to 3 grams. Some people will take up to 6, but 3 seems to be the sweet spot for me. The antifungal diet, again, is no sugar, no cheese, no yeast, no fermented foods, no alcohol. So pretty self-explanatory on that one. Just cut out the crap, but don't cut out everything and then cause a blood sugar issue and exacerbate the stress hormone thing. Again, in all those other videos, I talk about that. But make sure you eat enough of that protein. You might help mitigate some of that by just doing that. For the aldehydes, pretty safe bet that there might be a molybdenum issue. It could be B vitamin, B2, B3, iron. Ammonium detoxification. Look at the blood work. You might be able to see it there. But it doesn't always show up. So sometimes if you don't get lucky there, then you'll have to, again, work with somebody that knows what they're doing. Creatine, if you're an athlete, that's a safe bet. Phosphorus to help make all that work. Molybdenum, or if you do know that you're anemic, then just go with iron. Don't take iron unless you know that you have a problem because you can build up iron. And that can become a heavy metal toxicity, and that could cause autoimmune related issues. So consider seeing a systems healthcare doc. That's what I do. I know that we see these types of patients all the time and we correct these issues. So those are the people that I know that I can trust. You might be able to find some other ones in your area that know what they're doing. But in general, these are the kind of overview things that you need to be doing when trying to correct a fungal issue. If you have any questions, you can always email me directly if there's short questions. Otherwise, I offer a 20-minute free consultation to anybody who's wondering about these issues or anything for that matter. It's all free. So if you want to schedule something there, you can use my link below. Otherwise, we'll see you in the next video. Thanks.